Mayor, very much. Now we're going to recognize Dr. Sarah Melton, and Mr. Griffith of Virginia is going to introduce you.
Thank you very much, Mr. Chairman. I am glad to introduce Dr. Sarah Melton. Dr. Melton chairs OneCare of Southwest Virginia, a consortium of substance abuse coalitions attempting to turn the tide against substance abuse. She is an associate professor of pharmacy at ETSU and most recently was appointed by Governor Terry McAuliffe to the Virginia Task Force on Prescription Drug and Heroin Abuse, an idea first proposed to the Governor by myself and others in the Virginia Congressional Delegation. Dr. Melton has a long history of working to address the substance abuse problems in Southwest Virginia. She was instrumental in bringing Project Lazarus to Virginia, and she is also working on the naloxone issues in Southwest Virginia and in Virginia. I want to thank you, Dr. Melton, for being here today and sharing your experience with our committee.
Dr. Melton, you're recognized for 5 minutes.
Thank you, Mr. Chairman, and thank you, Congressman Griffith and the other members of the subcommittee. During my testimony, I'm going to address key areas related to state and local initiatives that are making an impact, and I'll also address key areas where I feel the federal government can assist in these areas. The first key area I will address is education of prescribers. As you're all aware, students and residents in healthcare professions have limited exposure to curricula in identifying and treating substance use disorders and appropriate prescribing and dispensing of controlled substances for chronic pain. But in Virginia, we're working together to bring leaders from all healthcare schools together to assure that our prescribers and dispensers of controlled substances have received an adequate education on addiction and the treatment of chronic pain. Overall, more funding is needed from the federal level to provide expanded graduate medical education opportunities for training in the identification, referral, and treatment of substance use disorders. As changes in federal funding allocated for graduate medical education are currently being discussed, it's an opportune time to assess how funding can best address training in addiction medicine. Tennessee has a mandated annual continuing education requirement for prescribers. Virginia, however, does not have that. OneCare of Southwest Virginia has joined with the Medical Society of Virginia and the Virginia Department of Health to provide no-cost continuing medical education to all healthcare prescribers as well as dispensers. We have been able to educate over 2,000 prescribers and dispensers in the past 3 years. We're currently evaluating how that continuing education has changed prescribing habits, attitudes, and registration to the prescription drug monitoring program, as well as other outcomes. I wanted you to note that in January, a letter was sent directly from Secretary of Health and Human Services, Dr. Bill Hazel, to all prescribers in Virginia. The letter specifically addressed new legislation that requires prescribers to be monitored, to be registered in the prescription drug monitoring program. But it also talked about how to use the PMP programs in clinical practice. I'm happy to report as a result of that letter, the prescription drug monitoring program registrations dramatically increased, and we're seeing a steady increase in inquiries to the PMP in the clinical setting. We're going to be sending a letter to all pharmacists in the Commonwealth in the next month. With regard to access to naloxone, both Virginia and Tennessee have recently passed legislation that will provide wide access to this life-saving medication. And OneCare has worked extensively with the Virginia Department of Behavioral Health and Developmental Services to train people across the Commonwealth through Project Revive. Last summer, Senator Tim Kaine attended one of those trainings in Lebanon, Virginia, and as a result of his training, he's introduced legislation through the Opioid Overdose Reduction Act to offer Good Samaritan protection for first responders. It's my hope that Congress will pass this legislation so that we have a consistent Good Samaritan protection across the nation. One barrier we are finding with naloxone, though, is the cost. It is not mandated by insurance companies to cover this medication, and it really should be. With regard to treatment, medication-assisted treatments with methadone, buprenorphine, and naltrexone have become an essential component of a comprehensive treatment plan for opioid use disorders. The issues that we have now is that we need a modernization of federal law to further expand access to these life-saving medications, but we need specific best practice requirements and recommendations for prescribers and insurers, such as Medicaid and Medicare, to make sure that certain patients are receiving comprehensive care by competently trained healthcare providers. Also critical is reimbursement for parts of these programs, such as urine drug screens and the necessary psychotherapy that accompanies the medication treatment. With regard to monitoring with the Prescription Drug Monitoring Program, both Virginia and Tennessee are members of the National Associations of Boards of Pharmacy Interconnect program. And I'm very happy to find that the bill that will fund NASPR is being proposed, because the funding for that, the allocation, will help all states be able to participate in a national prescription drug monitoring program. There is one concern I have, though. You may or may not know, a concern that we encounter daily in clinical practice is that methadone clinics are not required to report methadone dispensing to the prescription drug monitoring programs. This is a very serious situation, because if these patients do not disclose this to their primary care providers, and if they don't know it when they access the prescription drug monitoring program, we often see other opioids being prescribed, benzodiazepines, that can lead to death. So that is an issue of concern. And in contrast, buprenorphine, of course, is reported to the state prescription drug monitoring programs that allows for more monitoring for safe and appropriate use. Thank you for the opportunity to testify and for your ongoing commitment to this epidemic across the United States.
Thank you. And now I'm going to recognize Vice Chair of the committee, Mr. McKinley, to introduce Dr. Maxwell.